Good morning all, I welcome you to the case study video of this particular equipment which is called as an audiometer. So with this audiometer we are going to discuss what are all the functions available in this audiometer and how to conduct an air conduction audiometry test to a particular patient. So here we have a setup over here. So you can see that this particular equipment has two different kinds of tests. One is air conduction, another one is bone conduction test. So here we are going to have air conduction test. So in this we have selected the air conduction first by selecting the particular module, and how this particular stimulation is given to the patient is through this headphone. So through this headphone we can able to classify, or we can able to differentiate both left and right ear separately. So I have give this headphone to one of my students to wear it on. And here we have set an audio level of 40 dB and a frequency of 100. So with this equipment we can able to change the frequency, and we can able to increase or decrease the decibel level, and we can able to change the left and right ear accordingly. So could you explain what is this one?
This is used to tap. If we hear some noise, we could press this so that the person inside, like it will be separated first of all. The patient will be in a separate room with fully covered with glass, so that they can't hear outer noises. Only from this noise will go to the patient's ear. So if they are hearing or not, we have to check, right? For that we will give this. If the patient hear this, you can see this. We can insert our finger, and if we press this, a response will be coming here. Okay. So this is what will usually happen for this. And now we are giving this to the patient.
So the patient has been isolated to the machine, so the patient is not able to see the information what we are feeding in here. So the decibel, the frequency, and left or right where the sound is being given to the patient cannot be seen from this particular machine. So the patient has been isolated. Could you please explain what are all the options available here, or how to use stimulation using this method? Anyone else?
So basically we have a frequency, like we can maximize the frequency by pressing this upward direction, or we can reduce it by the downward direction. And we are also having the masking levels. Masking is nothing but we are focusing on only one side, and we are just covering the other side. So we have that to adjust that also. We have two levels, and also for left and right and for going up and down, we all have the options here. So this is what basically happens, and we have a menu that shows other options too.
So now we have set all the things. So we have here a sound level or noise level of 40 dB is fixed, and the tone frequency is 100 Hz. So you can see here, if I press this stimulus button, one stimulus is being created, and the patient can hear both the frequency and the noise what level we have set here. So if I press stimulus, the patient should hear, and if the patient hear, he has to press the response button. Otherwise, we have to go for certain level of increase in the frequency. So if I press this PLE level increase button, I can increase the level of dB what the patient has to listen to. And now again I am pressing this stimulus button. So if it is not heard by the patient, we try one more time and giving the stimulus to be able to see the light glowing over here from the machine. And if I take off my finger from this button, it has gone off. At the instant, it is like a push button. If you press, then at the particular instant, the sound will be heard by the patient. If it is not heard by the patient, again, you will just increase the level of your sound, that is to 50 dB. So this process has to be continuously done till the patient get the response.
So you can see here the patient have gave the response since we have increased the decibel. So from 40 decibel to 45, then now it is 50. So the basic hearing of the patient starts from 50 decibel. We can come to a conclusion by this.
So can you able to change the menu over here? You just press the menu button and tell whatever things you see on this.
So there are three types of tests here. One is air condition test, another is bone conduction test. So we can select the method what we are using.
Okay. Now the next person. So press 1 over here to select air condition. What are things is being observed here?
After I press the 1, we have the tone levels to the ranges. We have to keep the frequencies
In hertz.
In hertz, and masking of that air we want to left or right, we can select by this.
Okay.
So we can change using these numbers, and the options in menu, the rate, the decibel ranges.
Yes. If you want to come back, you have to press menu again. Yes, menu again. then you can able to adjust the things. Then you try to increase the frequency and the stimulus. Just identify what changes the machine is going to.
So as of now, I increased the frequency. The frequency ranges move from 1000 ranges between 2000 ranges. So I can increase the frequencies and can access the simulations, so the patients can hear their audios from their earphones.
So like this, we have to repeatedly measure for various decibel value and various frequency for the patient to understand whether the patient is having any trouble in hearing the normal frequency range, that is 20 Hz to 20,000 Hz. I hope this particular demonstration and case study have given you a small insight on how to use this audiometer for getting the response of the patient to understand whether he is normal or abnormal in hearing. Thank you for watching. Thank you.